Hello, everyone, and welcome. Thank you for joining us today for our third virtual event during National Nursing Week 2025. My name is Angela Wignall. I'm a registered nurse, and I am the Chief Executive Officer of the Association of Nurses and Nurse Practitioners of British Columbia. Today, I am joining you from the unceded homelands of the Lekwungen-speaking peoples, the Songhees and Esquimalt First Nations, in what is today colonially known as Victoria, BC. These lands are also home to the Métis Nation of Greater Victoria. And as the Provincial Association for Nurses, we support and enable nurses working across the full breadth of what is today known as British Columbia, the homelands of over 200 First Nations, Métis communities, and Inuit. We raise our hands with gratitude for the First Peoples of these lands and to be in respectful relationships with them and with the beauty of the lands that we provide care on every day. I welcome everyone who is joining today. If you'd like to join in the chat to acknowledge where you're joining from today, the homelands that you are on. I could not start off today without first saying Happy National Nursing Week. The theme for this year is the power of nurses to transform health. Every day here at NNPBC, we have the privilege of walking alongside the over 77,000 nurses in British Columbia, as you do just that, change and transform health and care for patients, families, and communities. We do this as a unified nursing association, the first of its kind in Canada, with all nursing designations under one unified umbrella. Nurses are not just a workforce. We are leaders, creators, innovators, and the largest group of care providers on earth. We are vital to shaping care, driving innovation, and delivering patient-centered, trauma-informed, and culturally safe care every day and every night. And at NNPBC, we work for you, the nurses of British Columbia, and we are nurses too. As a proud registered nurse myself, I raise my hands in gratitude and in celebration for all that you do in these very challenging times to meet the needs of others. I also would like to thank our partners who are joining us today, because we do not do any of our work alone. And I appreciate you lifting up and celebrating the nurses in your work and in your life this week as we celebrate National Nursing Week. NNPBC is focused this week on a virtual learning series. On Monday, we focused on Indigenous nursing and anti-racism praxis. And yesterday, our Nursing Initiatives for Primary Care team shared how NNPBC is working in partnership with the Ministry of Health to advance practice and employment opportunities for nurses in primary care. Today, our conversation focuses on leadership, how nurses are united in leading provincially, nationally, and internationally. I'll also share that today we celebrate the launch of the NNPBC Strategic Plan 2025 to 2027. Over the next 2 years, NNPBC is focused on strengthening our impact as your professional association, driving practice excellence and innovation, advocating for health systems change using nursing expertise, and sustaining and growing the association. You can learn more about our strategic plan on our website at nnpbc.com. It's now my most distinct privilege to introduce our colleagues who are joining me today for our conversation. First, I'd like to introduce Sukhwant Jassar, Chair of the NNPBC Board of Directors and President of the NNPBC Nurse Practitioner Council. Dr. Jassar is a primary care nurse practitioner and works with medical assistants in dying teams in both Fraser and Vancouver Coastal, where she assesses and provides patients with assisted dying as an end-of-life care option. Next, it's my honor to introduce Tess Kroeker, the Director of Nursing for the Bachelor of Science in Nursing program in the Faculty of Health Sciences at Douglas College. Tess is a registered psychiatric nurse, a doctoral candidate, and also a beloved former member of the NNPBC Board of Directors, as well as the former RPN Council President. And last but certainly not least is Rani Srivastava, member of the NNPBC Board of Directors, representing the Nurse Education Council of BC. Dr. Srivastava is a respected nursing leader and is also Associate Professor and Dean of Nursing at Thompson Rivers University. Thank you so much, you three, for joining me for this important conversation. We're going to jump right in to talk about our work as a unified presence in nursing at the provincial level. As the Professional Nursing Association, NNPBC is home for you as a nurse in British Columbia, for LPNs, nurse practitioners, RNs, and RPNs. No matter what domain of practice you are in, no matter what your role, your compensation model, or where you work, we are your professional association. And so with that in mind, and with the legacy of contribution that each of our panelists bring today, I'd like to open up the panel with the question of how has your participation with NNPBC as the professional association supported your development, growth, and understanding of nursing leadership at the provincial level? And perhaps I'll start with you, Suki.
Thanks so much, Angela, and happy Nurses Week to everybody. Thanks for having me here today. So I've been with NNPBC for about 3 years now with the Nurse Practitioner Council, currently the president of the NP Council, and with the board of directors and currently the chair of the board. And so over the past couple of years, I've learned quite a bit about good governance, improving governance structures, developing strategic direction, both in the short term and the long term for the association, aligning our work with the organization's missions, values, and strategic direction. I've also worked on engagement with membership and advocacy at the provincial level, including connecting with nursing leadership and with government on matters pertaining to nurses and nurse practitioners. So overall, working with NNPBC has been a really great experience for my professional growth. I have a stronger understanding of higher level structures, systems, and processes, and I can truly take this experience and apply it to other contexts throughout my career.
Oh, Suki, that's wonderful and amazing to hear. Your contributions here are so immense. Ronnie, can I ask you next to answer that same question?
Oh, for sure. And I think some of it will be similar to Suki's, I think. So again, happy Nursing Week to everybody. And I just want to acknowledge I'm joining from the traditional and unceded territories of the Tecumseh District Quebec. I did put it in the chat. For me, the opportunity to be connected to NNPBC and the privilege of being on the board has just been amazing. So I have been connected to the board for, I want to say, about 4 years. I was relatively new to British Columbia at that time. So I have my nursing career is about 45 years now and counting. But a lot of it has been in other provinces and mainly in Ontario. So coming to British Columbia, and I think, I really resonate with NNPBC because helped me find a home, find a home for my own identity as a professional. And what does it mean to be in this region? Healthcare is provincially administered. So we're trying to understand both the organizational structures, who are the people, who are the colleagues I need to be learning from and reaching out to and building relationships. So it's really been a wonderful resource to learn the issues, the documents that I could be going to. So it was almost my one place to go to look for information and find resources and people. So I think for me, that's been really, really personally very gratifying. And then to be able to bring those resources within my capacity as dean to share with my colleagues, with my faculty to say, hey, have you thought about? For me, I've also passionately been involved in thinking about the next generation of nurses, no matter what my role has been. And so to expose students to the idea of professional associations, and students learn that in our program, right? They learn all about regulation and what supports nursing. But I think to be able to bring a lived experience and current um, examples and making that connection with our students, I hope that also serves to create a lesson and a legacy for our students to understand that no matter where nurses are, they are surrounded by a community of caring, resourceful professionals that can help them no matter what. And I think that and reflecting on it for Nursing Week, Angela, the theme for this year is the power of nursing. And I think I really hold my hands up to NNPBC and all of the colleagues. I have been so impressed with the power of colleagues working with NNPBC, the staff, the board members, the various committees, the councils, and how nursing voice is amplified, how nursing voice is at the key tables, and how it has been influential in informing policy, in helping politicians and people and or leaders make informed decisions that impact the health of all of us. So I'm very grateful for that.
Thanks, Ronnie. And that line of sight to future generations really resonates with me as well. Tess.
Thank you both, my colleagues, and some things that I say will also be a bit repetitive. It's my pleasure to join you from the ancestral lands of the Coast Salish peoples, which is Coquitlam and New Westminster, coming to you from Douglas College. NNPBC is a tremendous force. It wasn't very long ago that I was employed by the College of Registered Psychiatric Nurses of BC, and the advocacy work and regulation were all bundled into one, which is just such opposing forces. And so NNPBC really truly is the voice of nursing for the province. And over the years, we were reaching out to government in the early days. We were reaching out to government for the opportunity to be heard and to submit statements on positions that related to healthcare, to the nursing profession. And now government reaches to us. And so just simply that transition and that respect that NNPBC has gained because of the expertise that we offer. We are only able to do that because we are unified. We are the unified voice of nursing. And that includes our provincial voice, but also our national voice. And so over the years, NNPBC has been very strategic in terms of representation at policy tables. Recently there's the formulation of the nurse education leadership table, which is definitely something that we need to focus on as we look toward the future in terms of our nursing numbers and the quality of our nursing education. So again, I can't highlight the importance of NNPBC as a unified voice for nursing in the province, but also our stake in policy development in the country. So it's my pleasure to be here and to be able to speak as a nurse, but also as a psychiatric nurse. So I look forward to the conversations.
Thank you so much, Tess. And I think you landed on a really important part, that is, the unique role that the association plays in the provincial landscape. We have our wonderful regulator who protects the public, BCCNM. We work alongside our incredible union partners like BCNU, who really advocates for those conditions of work and compensation. And the association holds this important third space where we are really the professional association for advancing the profession, for driving those nursing opportunities to engage in health and social policy. And it's a three-legged stool. We need all three. I think you're absolutely right. And as we look out across this provincial landscape, one question that we often get at the association, and that's on nurses' minds, is the question of the legislation that guides our practice, that frames who we are as nurses. Many of you know that the current legislation is the Health Professions Act, and it's been in effect for quite a while. But in 2022, that legislation shifted to the Health Professions and Occupations Act, or HPOA. And while the legislation received royal assent in 2022, it is not yet in force. That is, it's not yet in effect, but we do expect it to come into effect sometime this year. So now that it's right around the corner and we're looking at this change in the legislation that governs how we work, I'm curious for our panelists today, what is it that you see as key takeaways for nurses to understand about this change in legislation? And perhaps, Suki, I'll go to you first.
Thank you, Angela. So I like to kind of start off with a bit of background, like what is the HPOA? So the HPOA in BC aims to modernize the regulatory framework for health professionals with a key focus on protecting the public from harm. promoting anti-discrimination, and then improving oversight of health regulators. So I feel that the HPOA has impacted nursing much less than other health professions. The bigger change, speaking to the integration of midwives, has already occurred in 2020. And then the attention of the HPOA is to assure good regulation. And nursing has not historically been a major issue. For instance, nursing commitment to cultural safety and humility has been a long-standing priority, and there is always a testament to growth and learning. And so the college does have standards and code of ethics frameworks that includes anti-racism and anti-discrimination requirements, and these apply to both the regulator and registrants. The college also has several new regulatory tools to assure that nurses are practicing safely and remain current with practice, which again, I know nurses routinely undertake self-evaluation, self-reflection practices on their personal and professional growth, which I remember stems back to nursing initial education years. So not too much change for the nursing profession.
Thanks, Suki. I appreciate that historical thread as well, telling us a little bit more about that context. I'm wondering, Tess, Ronnie, if you are seeing from your perspective in the practices that you engage in, how the HPOA is going to be impacting nurses in diverse settings. So whether it be in education, leadership, practice, or administration.
I can add a couple of comments, Angela, and I think it's, as Suki has said, I don't think HPA is impacting in terms of in a way that is going to create a lot of new things for nursing education that nursing and nursing profession wasn't already paying attention to. But just stepping back, and I think about the importance of regulation like this and the framework and how it impacts on nursing leadership and nursing practice. So, legislation, I mean, if you think about why does it exist, it's really to look at, for me, it's about public protection, but I always think about regulation in two ways, right? It's about promoting excellence and it's about promoting accountability. And for me, they're both related. So legislation will pull out, this is what you need to be able to do. These are the current things we want to ensure that any profession is meeting those guidelines, those requirements in order that they're providing safe, good care. Legislation puts out accountability in terms of what happens if people are concerned about that. And I think those levels of accountability is also something that we as nurses need to learn at all levels, right? It is about the opportunity for somebody to complain or raise questions about, to say, hey, I don't know that I'm happy with that. How do we have that dialogue? How do we make sure that we take that very seriously and learn from that in a way of continuous improvement? And I think, as Suki is, when Suki pointed out to things like implementing anti-discrimination and cultural safety, we know those are all really important issues that aren't always easy to talk about and aren't always heard when they are talked about. So I think it really does promote us. So I always encourage people and our students and colleagues to think about regulation as it exists to make sure that we're doing the best job we possibly can and are being accountable to our those we serve, to our clients, but ultimately to our profession, right? So anyway, I'll pause there.
Oh, thank you both. And I'd like to just add that my sense is that it sort of is another step away, just in terms of distance, but it's not necessarily a bad thing. The role and the responsibility of the regulator is primarily motivated by protection of the public. But I think it's incumbent upon nurses and professionals to ensure that we are still represented in those consultations, and so that includes sitting on committees, by being involved. I chair Provincial Leadership, Educational Leadership Committee, and we ensure that the invite goes to the college so that they are part of our discussions. So I think that it's important to maintain those relationships, but it also highlights the fact that nursing is still sort of this self-regulated profession, and as an educational institution, when we do our annual competencies, it's actually still quite benign. It's really not too overly involved, but I think that now we're faced with a time where we really need to dig into competencies. We need to be, as institutions or partners, be establishing a higher standard for nurses to be able to achieve. And so I think because of the movement toward and maybe a little bit more distance, there's more responsibility on employers. In my case, it's a nursing educational institution. I think there's more responsibility on us to ensure that we, are up to date with our competencies, that we're actually developing modules for nurses to be able to learn and develop and grow. So, more responsibility for us as nurses and employers, I think.
Thank you all. And I'll just pick up on two threads that I heard there as well. That first one, I think Rani and Suki, you both mentioned about how the HPOA strengthens our commitment to anti-racism and to cultural safety and cultural humility. And as nurses know, we do have a practice standard around cultural safety, cultural humility, and Indigenous specific anti-racism now. That's the cornerstone of our practice as nurses. And at NNPBC, we've been really focused on developing supports for nurses to understand how to enact anti-racist praxis, to bring that historical knowledge forward into those moments of care that we provide, or those moments of education where we're leading students. And the other piece I'll build on there, Tess, is your point around being self-regulating and autonomous. As self-regulating health professionals, we hold an immense amount of responsibility. Previously in our discipline, we might have described it as a social covenant, but there is a unique relationship between nurses and the public that we serve that lands the responsibility for that on our shoulders. And so reminding ourselves that our regulator does set those standards for us, set those expectations, and each of us is individually responsible for our competence and understanding that those controls on practice and the frames for our practice. There is information available for nurses who are interested in learning more about the HPOA. Andrea, who is our blank space on the screen, our administrator, Andrea Lloyd, has dropped that into the chat as well, the BC Health Regulators website. So nurses can go there to learn more about this regulatory landscape change. And NNPBC is committed to sharing more as information becomes available as well. So next, I'll encourage us to take a step forward into the national landscape. So NNPBC is the provincial association, but we work very closely with our partners across Canada, including the Canadian Nurses Association, which is the national association for all nurses and our gateway to membership into the International Council of Nurses. And we really encourage all nurses in BC to become members of CNA if you're not already. And there are some noteworthy things that have happened in the past year or two at the national level, not the least of which was a recent election and the announcement of a new government this week. But one of the things that we'd like to draw attention to is the development of the Nursing Retention Toolkit. And NNPBC was a very proud partner in the development of this work. And this work that I personally participated in the creation of as well was representative of the voices of nurses from coast to coast to coast, naming what they need to be well at work, naming what they need to stay at work, and what it might take for them to return to the public health system if they've departed. I was really honored to serve as a member of the Expert Advisory Committee for the toolkit, along with colleagues from across the country. And our work included drafting and revising the toolkit many times. My particular area of focus as a bit of a policy and governance geek is the governance infrastructure section of the toolkit. And we also engaged with nurses from across the country to validate the toolkit, to make sure that it represents what nurses want to say about what they need to be at work. At the national level, we have the toolkit. And at the provincial level, we have a health human resources strategy that the government of British Columbia has committed to, which has over 70 unique actions within it. And as we think about leadership for nursing at work and retention in the workforce of nurses at that broader scale, that national scale, I'm curious, perhaps I'll go to you first, Rani, about how you've seen the toolkit and this work towards retention, recruitment, and redesign shaping nursing practice and the ways in which we lead or initiate change.
Thanks, Angela. Really good question. And I think, as you've said, the issues that I think our profession is navigating both currently and I think our future nurses will continue to navigate are very similar across the country. And I think that has to do with the nature of nursing and how nursing work is organized, right? And how it's understood and how it's enacted in different settings. Having said that, I think if you look at the dimensions of the nursing retention toolkits, and I won't, I think Andrea's has dropped it in the chat already along with the HHR strategy. I won't go over all of it, but I think from my perspective, some of the key things are thinking about how does the broader context impact on my ability as a nurse to provide good care? And how do I advocate for that? How do I advocate for that for those I serve, whether it's my students or whether it's my patients or communities? And how do I really think about keeping my own balance? When we think about what is it that causes nurses to leave the workforce from a retention perspective, it very much is around the ability, and I think for me, what really resonates is that flexible and balanced ways of working, right? Nursing, traditionally female profession, still, right? We see more and more males coming in, and that's great. But the majority of nurses globally are, and we see that in any global reports, it's still predominantly female. We know that nursing in many, many, many situations is shift work, which people have not the same level of control around either being able to control their schedule or think about balancing their own needs, whether it's mental health and wellness or family demands or something else, when you've got a strict schedule that is asking, and you need to be there. Like there's a reason the schedules exist. There's a reason those, staffing ratios and things like that exist, but it's hard. So I think nurses, for me, what's important when I look at the toolkit and I look at how nicely it's laid out, all of those interconnecting factors, is to think about how do we empower ourselves as individual. And if I translate it to my current role as an educator, to help our future generations think about as they graduate, they need to have the competence, the knowledge, skill, and judgment for the clinical care, but they also need to have the knowledge, skill, and judgment and those competencies to think about how do you thrive in a dynamic, complex, changing work environment, right? And this is where recognizing the impact of policy and all of those, so helping people think about the bigger picture, Angela, but also for myself, what does it mean to find mental health and wellness supports? Where will my professional development mentorship come from? Because we will all have days that are fantastic, and we will all have days about, and I signed up for this because, like, really? Couldn't I have been? And that's where we need to be able to think about who's going to help us, who's going to help lift us up, how do I ask for that help, because nurses don't know how to do that necessarily. So I think fundamentally these conversations are really, really important, not because they're giving you an algorithm to say do this, do this, do this, and everything will be fine, but it's helping us understand these are the complexities. Let's make them visible, and let's think about how we individually and collectively look at navigating. So how do we build capacity in individuals, and how do we build capacity in the system overarchingly?
Oh, Rani, I could listen to you talk about that for a long time. And particularly your points about how do we understand how to work in those volatile, uncertain, complex, and ambiguous landscapes that we are all in right now. We hear on a daily basis from nurses across the province who are struggling with exactly that. How do I be the nurse that I want to be, that I know how to be in the context of practice that I'm currently in? And those are nurses at the bedside in clinical care, but those are also nurses in leadership roles who are uncertain about how to move change forward through the system. Nurses who are educators, across the domains of practice, and that piece around the gendered nature of the workforce. You're absolutely right. I think in BC we're 91% female, and then a wide range of folks of other genders who are in our profession, and there is that important aspect to always consider. Tess, I want to throw to you on the same question about retention, recruitment, and redesigning the health system. how have you seen, tools like the Nursing Retention Toolkit or the HHR strategy supporting nurses in BC from your perspective?
Well, the two documents are really powerful documents simply for the purpose that if you take time and read and you pause, the thought process and the reality becomes very uncomfortable very quickly. And I think that's not the obviously the intended purpose, but what it is that they're built by nurses for nurses to be able to represent the realities of our workforce. And so the value of the documents are tremendously powerful from that perspective. And so when I first started looking at the nursing retention toolkit, for example, it didn't quite fit to a post-secondary environment, but it's not asked to fit perfectly in every environment. And so, my challenge to all of you on the call here is to consider, signing on like as a charter that you're looking to at least implement a portion of the nursing retention toolkit with the satisfaction that there's been extensive consultation across the country for this tool. Recently, and I think that, every employer scenario really needs to be mindful of recruiting and retaining nurses. When I look at the health of my nursing faculty as well as the health of the students, one of the first thing that comes to mind is just mental health and well-being. We still have this uncomfortable reality of nursing students who have graduated and leave the profession, within the first few years. And so how do we get in front of that? And part of it comes with just being able to examine, what is our preparation for students and faculty and navigating the current workforce. My challenge is to all nurses out there is to let's be kind to one another. Let's just pause and support one another. Recently the government, and this is honestly a direct result of the work that NNPBC has done, was able to offer upwards of around $4 million for grants for post-secondary institutions to apply for to develop strategies for faculty recruitment and retention. And I'm happy to say at Douglas, we were successful in that process. And so we're creating a nursing faculty resource and learning hub so that we can be, offering excellence in nursing, from clinical class design to evaluative components to mental health and wellness to formal partnership establishment within the province and nationally. This is the work that we need to do. So please have confidence that the retention toolkit will at least be able to offer you, some guidance in order to be able to establish, an examination of the health of your organization, and work toward improving things to recruit and retain nurses.
Thanks, Tess. And that, I think your point around the toolkit being representative of voice, almost to a certain extent like testimony, that this is, nurses documenting what it is that matters to them, really resonates with me, because I will share that sitting in room after room of nurses in the validation process and hearing their stories, hearing about how the 8 different themes really cut across every area, whether you're practicing in a rural setting or you're practicing in a tertiary care center in a downtown urban setting. That, Rani, as you said, those issues are across the full breadth of what nursing is. And that piece around mental health and wellness, it's so much more than individual resilience, right? It's contending with a system that is very challenging to work within right now. And it's certainly part of why we as the association have taken that step of offering mental health services with our partner Advocate to all nurses in BC, because we recognize exactly that it is difficult to pour from an empty cup. We have to take care of ourselves as we do this work. So, Suki, you haven't had a chance to chime in on this particular one yet, so I'll open the floor to you and ask the same, similar question. If If we imagine the nursing retention toolkit as being this transformative opportunity for change, these threads that we can pick up, the voices of nurses that we can listen to, what do you think employers or organizations need to do to better focus on those themes to support nurses?
Yeah, thank you, Angela. I agree with Ronnie and Tess speaking to, well, retention is a real issue, and nursing issues are similar across the country. And so this toolkit is essentially targeted for employers such as health authorities, with strategies that the employers can implement at the organizational level. So I like how the toolkit highlights particular initiatives that already exist and that can be scaled and spread across the country. So essentially, employers are encouraged to initiate implementing the toolkit by identifying their own gaps. So the example initiatives really point to not really needing to reinvent the wheel per se, though reviewing what has worked well in other jurisdictions, making a case for their own regions by sharing the evidence, and then leading projects to implement change with using similar initiatives.
I'm so delighted that you pulled those forward because my goodness, is the toolkit full of good ideas. And all of across every single one of those themes, there are examples of organizations who are doing a really good job of each one of those recommendations. And you'll see as you go through the toolkit that there are examples from British Columbia across many, many different areas in the toolkit. So we're shining nationally in many areas, and while there's lots of work to do, it's always great to have the moment to celebrate the things that are going well and the places that are doing a great job of retaining and recruiting nurses. And I know today, in this week, there's a lot of focus across the country on our partners and our fellow humans to the south of the border, including recruitment of US nurses to British Columbia, which is on the agenda for our government. And, I'll just share in there that nurses, whoever makes British Columbia home, have deserves a safe place to work, deserves a safe practice environment, and all of these tools that we have. We have the opportunity to meet the needs of every nurse that works here, no matter where they've come from and how they've come to make BC home. In our last part of our conversation, I'm going to ask us to step even one step further out of our province and think of ourselves as a global workforce, as a global force for change. And so at the international level, we are millions of nurses strong. And we've talked about NNPBC as the provincial home for BC nurses. We've also touched on our national association, CNA, and how CNA is our gateway to membership in the International Council of Nurses, which is our international association. And this week, the World Health Organization and the ICN has released the brand new 2025 State of the World's Nursing Report. Just 2 days ago, that was released. And some of you might recall that in 2020, the first State of the World's Nursing Report was released. It was released during the International Year of the Nurse, what was initially thought of as a year to celebrate nursing. And of course, we all ended in the COVID-19 pandemic during the course of that year. So this new report takes temperature check. What has happened from 2020 to 2025? How have things changed since our experience of the COVID-19 global pandemic? And it features some new information about the nurses around the world, both as a workforce, but also as a force for change and a force for leadership. And so I'll pose to our wonderful colleagues here, Rani, Tess, and Suki, what are your thoughts on some of the key takeaways, and how do these global policy priorities align with the way that you see nursing in BC and in Canada? And perhaps I'll go to you first, Suki.
Yeah, thank you, Angela. So I read through the report, and really, it's speaking to the global crisis on the shortage of healthcare workers, and it features new indicators on critical areas for nursing, such as education capacity, advanced practice nursing, and remuneration. So I'd like to I'm a nurse practitioner, so I'd like to just speak from that lens, in terms of education and service delivery. So there is a shift in Canada to a generalist program for NPs across Canada. And there is the elimination of the BC OSCE, allowing NPs from other provinces, territories, and the US to move to BC without having to overcome that barrier. There's also mechanisms being created at the college to support NPs trained in specific populations or specialty areas to be able to work in BC. So there has been a lot of change aligned with the global movement, national movement, and initiatives. But we do need to see further investment into residency programs for specialized areas, such as emergency departments, in order to support NPs and sustain NPs in these areas. And so my thoughts go back to the nursing retention toolkit here. We also need continual advocacy on equitable remuneration or equal pay for equal work for NPs working evenings, weekends, and holidays. And so just further speaking to their priority areas of jobs and employment, there is a high demand for recruitment and retention of nurses in rural and remote areas. Lots of work has been done here, but BC still needs to continue to invest in initiatives and also create new initiatives for advanced practice nurses such as NPs into these areas. So we know emergencies have shut down, NPs are willing to provide this care, but we essentially need government investment and continual advocacy efforts from our association.
Hear, hear, Suki. I could not have said that better myself. It's interesting to look forward to see the landscape for nurse practitioners that's coming for us in 2026, and absolutely agree with you around the need for those investments. They're critical. Perhaps I'll come to you, Tess, and ask you a question about the same, the State of the World's Nursing Report and the companion document, the Global Strategic Directions for Nursing and Midwifery up to 2025. I'm wondering what your thoughts are on how these global direction setting documents and pieces of information impact your thinking as a nurse in BC.
Yeah, well, I think definitely on a high level, we can relate to a lot of the issues that have been identified and the challenges. I think the strategies, is a little bit more delicate because we do have provincial, nuances as well as national nuances. My primary sort of thought is reclaiming the narrative for nursing in the province and in the country. We are a victim of the global pandemic. We were heroes, initially, and then that narrative changed. And, so it's funny times. Right now, I think that nurses really need to reclaim the voice, to be able to share at every opportunity what it means to be a nurse, the pride that we have for nursing and the value of the profession. We have also had to respond to changes in policy so that nurses are working to a higher, or to the maximum scope of our practice, as well as, the increased role of nurse practitioners in the province. Nursing as a profession is evolving, and I think that we're at the behest of the governmental decisions. Another example is the fact that one department, because of sensitivities around housing and the cost of living, had capped our international student numbers, and so that has had far-reaching implications for enrollment. And so I would like to, number one, see us being able to identify connections and partnerships with government, so that if a decision is made in one aspect of government, then we can look a bit further downstream to see the potential implications of those decisions. And again, that's the role of NNPBC, is to make sure that we're at those tables, to be a part of a national and an international movement to reclaim the narrative of what it means to be a nurse, and to regenerate that pride that we have for the profession, and step outside of the negativity. And again, just to highlight the fact that be at the tables so that we can ward off the potential devastating impacts of one governmental decision that can significantly impact nursing. So I think that the the document itself is a very good guide, but we really need to be responsible provincially and nationally.
Thanks, Tess. And I think your point around nurses reclaiming who we are and reclaiming how we describe ourselves, how we hold ourselves within these roles and within change. I'm reminded of a quote from a Canadian nursing leader that I recall hearing, which is, we need to act as if we are powerful because we are. And I think that, as we think about who is best connected, who has the deepest roots in community, who is optimally positioned with the knowledge of communities and families, schools, workplaces, hospitals, who is there day and night? Well, it's nurses. And we know the gaps, we know where they are, we know how to collaborate. We're natural systems thinkers to be able to make close the gaps for change that we need to close, and to think of ourselves not as a workforce, not just as implementers of other people's good ideas, but the folks who lead that change. I really appreciate that, Tess. Rani, I'm going to jump to you on this question around how the State of the World's Nursing Report and these international directions influence your thinking as a nursing leader.
Well, I've just started to scan through the report, and it's actually a phenomenal resource. What I would encourage people to, you know what, I know the link is there. Download it, scan it. Don't worry about reading it from cover to cover because there's amazing information there. And it adds to what my thoughts adding to what Tess just said around reclaiming of nursing voice. Like when I look at themes, and again, just like we made the comment about, in the nursing retention toolkit, the issues were the same nationally. The issues that are surfacing in here are, again, they're global and international. So I think it really helps my voice becomes stronger when I know that what I'm saying and how I'm speaking as a nurse from that nursing perspective is supported, that it resonates what nurses across the country and across the world are saying, right? So for me, it just really strengthens my own sense of confidence in my own voice. It also gives me a sense of urgency to speak up on some of these things. So a couple of things to highlight, right? The report again highlights what we've said, the predominantly female profession. It's got articulated issues around, where nurses work, nurses having that public sector, as a profession, and you talked about this, Angela, when we talked about the self-regulating profession. As a profession, we are a public sector profession, right? There's a social contract that the profession has with the communities, whether we call it that or label it or that or not. But you see that come through in different ways, the way nursing is situated across countries. It looks different, but it's not that different, right? And so when I look at it, there's so many, I'm like, yes, that makes so much sense. So resonating it, and I think just maybe highlighting, because I'm mindful of our time as well, is that it also articulates where are the common and challenges, and both Suki and Tess have talked about some areas of further focus for us in BC, and I'll just pick up on that. Like one of the things under education is, we keep saying there's a nursing shortage, and so let's just educate more nurses, right? How hard that can be. And then we talk about where are the bottlenecks, and very clearly it shows in the report. The bottlenecks to nursing education are, again, those practice sites, the clinical sites, who's there, who's mentoring, where are the leaders, where's the faculty? And I think there are also some opportunities more and more, and I think this is where it'll be both strengths and challenges to navigate when we think about the digital world. Lots of opportunity for us to learn from our international global partners. They're amazing stories about, sometimes it's for me, going to international conferences is really humbling, because we think about, we don't have this, we don't have this, and we don't have this. And you think about what some people are doing with very little. And that ingenuity and ideas is really inspiring to bring back. But then you also think about our abilities to connect and learn from each other digitally. What does that do? How could we get education more accessible even within the country than to sites that are more rural and remote? So I think I would really encourage people to look at the World Report just for those reasons, that there are ideas, but it also will make, for me, what really, as you asked me the question about how does it influence me, I think it just strengthens my voice and my passion.
I love that. And I love that idea that we are not alone, right? That we have I think we're 29 million strong across the globe. And I recall the Canadian Nurses Association in the most recent election, they had a social media campaign that nurses are 1 in 57 voters in this country. So we are a powerful force. There is no two ways about it, around the world and here at home. I'm looking forward to representing British Columbia and NNPBC at the upcoming ICN Congress in Helsinki, where NNPBC will be sharing work from our primary care programs, as well as leading a policy summit, a global policy summit on some of these issues. And so it will be an exciting and important event for us to participate in as British Columbia nurses and as your association being present there. Turning the corner in our last 10 minutes, I'm going to ask you the last question, and then we'll jump into some questions and answers. The last question is perhaps your 1-minute vision for the next 5 to 10 years of nursing. Where do you see us going as a profession in advancing the health and well-being of British Columbians in 1 minute or less? I'll start with you, Suki.
Thank you, Angela. So the first thing that comes to my mind is just adapting AI technology. I don't think we've spoke about that today. And so it's a really hot topic right now. And so the nursing profession needs to include a focus on adapting AI, for example, implementing tools that enhance practice and patient care, improving data analysis, and using data to inform practice and improving efficiencies. We also need to continue to advocate for nursing-led health policy and collaborating with other health professions and government to implement policy changes. And we need to continue to address the workforce needs and challenges, speaking to retention efforts and advocating for the use of the nursing retention toolkit. And then as well as specifically expanding opportunities for nurse practitioners and nurses across settings while also supported with residencies and secured continuing education. I feel like throughout our discussion and even just looking at the ICN agenda, a lot of this is in line with our national toolkit and the international report. So I feel like globally, nurses, it seems like we're on the same wavelength.
Absolutely. That's a great vision. Thanks, Suki. Tess, I'll come to you next. What's your 1-minute vision for the future of nursing?
Yeah, I lead with let's be kind to one another. Welcome my students into your clinical sites and be supportive, and enjoy the questions that they ask, and the big eyes that they look to you for leadership. Get involved, look at committee work, have the opportunity to, when you do have the chance to speak of nursing, to reset the narrative. Let's take our profession back. Let's move beyond some of the negative media that's out there for nursing. Yeah, just look forward to working with all of you in one capacity or another as time goes on.
Thank you, Tess. Kindness, absolutely. Ronnie, your 1-minute vision.
My 1-minute vision is I hope that nurses, and I think I see this now, and I want to see it even stronger as nurses and other nurses see themselves and others see nurses as knowledge workers, right? Which is what, and in terms of, which means we need to be embracing technology, we need to be embracing data, and we need to be embracing humanity, which includes the traditional and modern ways of knowing and being, and where does knowledge come from. So that knowledge worker for me is a really important theme that thinks about the technological knowledge and all of that, but also the traditional knowledge and what do we know. It's the humanity piece of it. I would love to see more nursing opportunities for autonomous work, nurse practitioners, NP-led clinics, community health centers where nurses of all categories can work together, because nursing is both autonomous and it's a team sport. And I think we need to think about how do we look at balancing that. And I think the third thing I would say is, and this is more for my students and my younger colleagues as somebody who's, kind of getting ready to be at that end of the spectrum in my professional career, is really thinking about, I hope people really get inspired by and recognize both the responsibility and the opportunity we have as individually as nurses and collectively as a profession. Like it is just, for me, it is quite powerful. We've talked a lot about that, about the importance of our voice, about the power of nursing, 1 in 57 voters. It doesn't really matter where you look. Individually, nurses can have such a powerful voice and have such an impact on, and we know that, on the lives of people, right? And collectively, we can have such an impact on the lives of our society and the health of our society as a whole. So I hope that nurses will embrace that, both the opportunity and the responsibility.
Thank you, Rani. That's a beautiful call to action. I'm now going to turn for the last 5 minutes of our time together to a couple of the questions that have been put in the chat in the Q&A. And the first question comes from Clara. Clara's noted that they have used the nursing retention toolkit in a small 12-bed hospice, and it's really tricky to incorporate all the strategies. They had to be strategic and pick one or two to focus on. And what Clara found tricky, being a nurse leader, was that they felt like they needed to support themselves to continue nursing after 20 years, while also doing the work of supporting and retaining the nurses under their charge. Are there any comments on how to do this as a leader? And I'll just throw it open, anyone who'd like to respond.
Angela, I can start because I put a little bit in the chat, and I think it really picks up on what you said around making sure that the leaders also have the support, right? The mentorship, the ideas from colleagues, and just the support about recognizing this is difficult work and it's often exhausting and unrelenting. And so how do we find the space to recharge ourselves as leaders, to be able to get good ideas from other people about how did you navigate this and got any tips? And knowing that, as you said, as a frontline, as a clinical care nurse, I want to use my knowledge to make sure I'm providing the best possible care. That's what leaders are trying to do. And sometimes it's not easy, many days, and that support is critical.
Absolutely. Suki, you want to jump in on there too?
Yeah, no, thank you for the question. I'm just reflecting back on the toolkit and how it's meant to be initiative advice for the employer at the organizational level. And that also makes me think about the leadership structure, as Rani mentioned. And so, we need to continue to work on like provincial and territorial approaches to leadership structures and growth, standardization in order for sustainability at that level. So if the high level structures are well organized and streamlined, then we'll have sustainability within our leadership, and the trickle effect to the front line would amount to better supported nurses and NPs. So I think that's something to consider, because it sounds like in this context, perhaps some of the more frontline or leadership nurses within that context are taking this on, and it's meant to involve higher level support.
Absolutely, all the way up and through to the Minister of Health and beyond. And I think, to your points, that there is sometimes a mistake, or not a mistake, but a misnomer that somehow the real nurses we're supporting are just the clinical care nurses and everybody else is the support team. But nursing across all domains of practice is doing the work of caring work. And, I am a public health nurse and I love caring for my patients, but now I spend time caring for the health system exactly how I would with my patients. So when we lead, we're caring for the nurses in our charge, just as we would for a patient. There's also a question here from Darren Abbey, and the question is, can I invite the panel to say more about the ways that our profession will improve how we demonstrate our competence? So I'm wondering in the last few minutes here if folks have thoughts about Darren's question.
Repeat the question again, Angela, please.
No problem. How can we improve the ways we demonstrate our competence?
For me, how we continue to improve that is by continuing to partner with those we serve. Because I think in that partnership relationship, nursing is relational, it's all about that. And we don't impose, we bring a lot of knowledge, but we work with people to look at our knowledge and their expertise and knowledge and needs, and ensuring that they come together in a very broad way, right? So for me, that is where I've learned throughout my career is how I've improved no matter what role I've taken on, is really thinking about, yes, I'm coming with a lot of knowledge and skill and experience and all of those kinds of things, but the improvement continues to happen when I listen to and I work with people, because that's when the knowledge gets refined and it gets applied and it gets added to. So I learn and grow, and in turn, I can share more with others.
Thanks, Rani. And I'll throw in there as we start to close that, there's so many opportunities in technology, simulation, other ways in which we can get creative with demonstrating our competence as well. Well, we've come to the end of our hour together. I recognize there is another question in the chat, and I will commit to following up with that attendee to answer that question. But I'll close our time today by saying thank you to our speakers, Sukhi, Dr. Jassar, Rani, Dr. Srivastava, and Tess Kroeker, for taking the time out of your day to join the conversation. And to all of you who've joined us at this virtual event, thank you for spending your lunch hour with us. We hope it was inspiring, insightful, and brought you a little bit closer to that full breadth of provincial to national to international. I encourage you to register for our remaining 2 virtual learning series. Tomorrow, we're focused on NP regional leadership. And on Friday, the fireside chat will focus on nursing research and quality improvement. For everyone who's joined, happy Nursing Week. Thank you for all you do every day and every night. Take good care.
Thank you.
Thank you, everyone.
Thank you.
Bye-bye.